In this video, we'll be talking about the question heart location and projections, auscultation points, and a scheme of a radiogram or an X-ray of a heart. Now, when you talk about heart location, you'll talk about topography in the pericardium. And whenever you talk about topography, you have to talk about each border present on each side of that particular organ. So we'll talk about ventral, dorsal, lateral, cranial, and caudal because, as you know, the heart it's present in right in the middle, kind of in the middle of the heart, middle of your thorax, right in the mediastinum, right? Okay, so ventrally you have your anterior inferior mediastinum, which has your sternum. Then dorsally, you have your posterior inferior mediastinum, which has your vertebral column. Laterally, you have your phrenic nerve and your mediastinal pleura. Cranially, that is on top, you have your aortic arch and superior mediastinum. And caudally, you have your diaphragm, basically the central tendon, which the heart technically sits on. Now, this is sagittal section of your mediastinum. You can like how the mediastinum is basically divided. There's a superior part and the inferior part. The superior has only one part, but your inferior has an anterior, posterior, and a middle part. The middle part is where your heart is present, and you can talk about the borders using this picture. Now, structure of the heart, this ventral, apex, and your dorsocaudal part, right? How do you recognize the orientation of a heart is through your veins, right? If you have two openings like these, it's basically your inferior and superior vena cava, so it will be your right atrium. And when there's four openings of like a vein, which is basically your pulmonary vein, that will be your left atrium. The apex, you have your vortex and the sulcuses. Interventricular sulcuses, there's anterior and there's a posterior sulcus. And then ventrally, this is how you can see, you have your pulmonary trunk, aorta, right atrium, and your left atrium. Right, but your left atrium has the auricle, like it's more prominent there, like from the ventral view. But they have three layers of muscles: outer oblique, middle circular, and inner longitudinal. Now, heart structures, general structures, there is the base. Okay, this is your base, and then there's the apex, right? Now, the apex is basically present in your fifth intercostal space, and your base has the great vessels. Now, ventrally, sorry, superiorly, you have your superior mediastinum, right? Now, surfaces, you have a right picture, a left picture. Um, so there's pulmonary surfaces, which is in your right atrium. Anteriorly, you have your right ventricular and partially the left ventricular. And then your left, you have your atrium and your ventricle. And inferior, you have your posterior of your both ventricle. These are the surfaces. There's four surfaces, and there's four surfaces: right, left, sorry, right, left, anterior, inferior that you need to talk about. And yeah. Now, borders and sulcuses. There's your right border. You can see the pictures, right? Uh, yeah. So this is your right border, your left border. Then you have the interventricular sulcus. And this is for your uh, it's for your veins, arteries, right? It's your coronary sinus. Your arteries pass through it, and yeah, this is your posterior interventricular sulcus. So sulcus terminal cordis, and the yellow part is your coronary sulcus with your arteries. So what is your coronary sulcus? It's majorly the right coronary artery, circumflex branch of the left coronary, great cardiac vein, and your coronary sinus that's there in your coronary sulcus. In the anterior interventricular sulcus, you have your interventricular septum, posterior interventricular branch of and great cardiac veins. And then the sulcus terminalis is your superior vena cava, inferior vena cava, and it is between the sinus venosus and your right atrium. Sinus venosus is basically the part where the openings of your superior vena cava and your inferior vena cava is present. Now, posteriorly, you have an interventricular septum, posterior interventricular branch, and middle cardiac vein. Sorry, this would be anterior interventricular branch, right? Okay. Now, auscultation points. Uh, Basically, these are the points where your doctors will place their stethoscopes in so that they can hear the particular valve, right? Again, so you have your aortic valve that's present in the second intercostal space on the right, the pulmonary valve, which is present in the fifth intercostal space near the sternum. Sorry, the pulmonary valve is present on the second intercostal space on the left. Okay, so how do you remember it? APTM. So APTM. The first aortic, second intercostal space on the right, and pulmonary left second intercostal space. It's kind of lined, right? And then you have a tricuspid and your mitral, which is your fifth intercostal space, right and left. But for the tricuspid valve, it's very close to the sternum. So like here, you'll be able to hear it. This is again another diagram. These are the four main valves, and there's other structures labeled here. You can definitely go through it. Yeah. So yeah, there's this part. It's your valves projection. You'll see like a lining of your pulmonary, your tricuspid, and all the valves, which is your mitral, your mitral, tricuspid, aortic, all of these. There's like a line, so they're called the valves projection. Now, X-ray of the heart. We will need to draw it and explain the parts again. So in your X-ray, you can see superior vena cava, ascending aorta, aortic knob, pulmonary trunk, left atrium, right atrium, right? More of the left atrium, I would say left auricle, then your left ventricle, right ventricle, and your inferior vena cava. Right? Again, this is how you draw it. It's important to draw it for this particular question because they have asked for it. Yeah, you can just see again right brachiocephalic vein, superior vena cava. Here they've started from like right brachiocephalic vein, your right atrium, and your inferior vena cava here. Your left ventricle is majorly the one that's seen on your radiogram. Your left auricle, pulmonary trunk, and aortic arc.